Pro-lifers in Michigan say they are dropping a petition drive to prohibit a second trimester abortion procedure in the state. Officials say the campaign did not produce enough valid signatures. The state's Right to Life group says that it will not dispute that conclusion and instead will focus on the elections this November. Officials in one part of California are considering removing St. Junipero Serra from their county seal. St. Sarah is shown on the seal for Ventura County, just northwest of Los Angeles, with a mission church in the background. The pastor at one of the missions founded by the saint says elected representatives do not know St. Sarah's true history of helping Native Americans. The University of Maryland St. Joseph Medical Center, a Catholic hospital, faces a lawsuit from a person who presents as a transgender man because it would not perform a hysterectomy on the person's healthy uterus. A statement from the hospital reads in part, as a Catholic hospital, UMSJMC abides by the 6th edition of ethical and religious directives for Catholic healthcare services as outlined by the U.S. Conference of Catholic Bishops, which provide authoritative guidance on certain healthcare issues and practices, including limitations on the removal of healthy organs. All Catholic hospitals in the U.S., including UMSJMC, are bound by these directives. Joining me now on Skype to talk more about this is Ryan Anderson, Senior Research Fellow at the Heritage Foundation. Ryan is also the author of the book, When Harry Became Sally, Responding to the Transgender Moment. Ryan, welcome back to the show. So good to see you again.
Thanks for having me.
Absolutely. So the plaintiff in this case is claiming discrimination, saying that surgery would not have been canceled if it were not for the diagnosis other than gender dysphoria, which is described by the American Psychiatric Association as a conflict between a person's physical or assigned gender and the gender in which they identify. What is your reaction to that?
There's no discrimination going on here. What we have here is a disagreement about the proper medical treatment for gender dysphoria. Some doctors, hospitals, healthcare systems think that sex reassignment procedures are the appropriate medical treatment. And other doctors and hospitals and healthcare systems think that it's not the appropriate treatment. And so the idea here that we're going to treat a disagreement about the best medical care for an underlying condition as if it's discrimination based on a person's identity kind of gets things exactly upside down. Good medicine doesn't remove healthy organs from the healthy person's body. And that's what's at stake here. A Catholic hospital will remove a cancerous uterus, but they won't remove a healthy uterus.
I know that you've studied this topic quite a bit. Let's talk about sex as it relates to good medical practice and how important is it to recognize those differences?
Sure. I mean, one of the things that doctors and scientists are increasingly discovering is how important the sexed body is for good medicine, that diseases impact males and females in different ways, and that medicines and various therapeutics actually impact male and female bodies in different ways. At one point, they were using only male subjects to test various drugs. And then they realized that the right dosage for a male might not be the right dose for a female, that the way in which a disease impacts the male body may not be the way that it impacts a female body. And so we need both men and women for clinical trials and men and women to kind of titrate the right dose, the right procedure to the specific body. And so you can't treat male and female bodies as interchangeable.
As we pointed out, the hospital clearly states on its website that it observes the ethical and religious directives for Catholic healthcare services. Shouldn't those religious concerns be considered?
Oh, of course. I mean, part of the founding nature of the United States of America is that we respect religious liberty, right? It's the first right in the First Amendment to our Constitution that's articulated, the free exercise of religion. So even if you disagree with the Catholic position on what good medicine looks like for gender dysphoria, there's no reason why you should say that the Catholic hospital has to abide by secular guidelines for healthcare, why progressive understanding of medicine should govern a Catholic hospital. One of the things that I think we're going to have to increasingly wrestle with is how do we coexist in a society where we have deep disagreements of foundational issues about identity, about life, about health, about medicine. And it can't simply be that the government can coerce the Catholic hospital into violating its beliefs about what good medicine looks like.
Oh, Ryan, thanks so much for coming on. We always appreciate your insight. Ryan Anderson, Senior Research Fellow at the Heritage Foundation and author of the book, When Harry Became Sally, Responding to the Transgender Moment. Thanks again, Ryan.
Yep, thank you.